We've had a lot of discussions in the industry about this word called telehealth. And the concept is to keep providers safe from going into a room of any potentially infected patient, to keep caregivers safe. And the idea arose about, well, if we can do telemedicine, why not do some sort of robotic mechanism to keep our nurses equally as safe? And so out of that idea, the idea was born, and the robotics department of the local ISDs came up as an idea. We made contact, and the student said, great, we'll get right on it in 2 weeks. And we said, we need it by tomorrow.
The entire idea is to have a way to deliver meds to patients without a nurse who might potentially be carrying the illness to go into the room. My guess is that this will be really helpful for patients who have cancer, who are on chemotherapy, who have repressed immune system, or people who are sick with other diseases that make them more susceptible to having the serious symptoms for COVID-19.
We sent bed tables to them Saturday morning, and so by Saturday evening, Abilene and Wylie both had 2 prototypes for us to look at and see if this would work. We brought it up to Zane Dennis, which is in charge of our facilities here, and he got with Tiger Manufacturing.
They asked if we could build them 3 stainless box covers to help with the sterilization of the equipment, and they needed it in a fast way. This is what we come up with in the fabrication part, was the stainless box cover for the robotic wheels. These are all prototypes. We fabricated 3 of these in about 7 hours. Then the box above it is the components for the robot, the remote receiver and such. Anything we can do to help the community, the surrounding areas, especially on the health crisis we're in right now, we're more than happy to help with if there's anything we can do.
I got an email at 8:40 on Saturday morning, and I said, you know what, we can do this. And then my second thought was, I have to get my students involved. But I was really glad that I brought my kids on board because, we cranked it out all Saturday and then Sunday morning. So we got it done in like 9 hours.
We used our VEX Robotics parts. They come in a competition kit that we were using from our school. All the parts that we used were either made out of aluminum or steel. Most of the parts that we used were made out of aluminum because it's lighter. VEX makes smart motors, which will connect to their brain, which can be programmed with the wireless remote. We just had to figure out how to get our robotics parts to work with the existing table infrastructure and how it was built.
You would put it all together and then there'd be something that's not quite right, so you'd have to take a bunch of it apart. It feels really good because it's nice to be part of something like this and be able to create and help out people.
Went through several different prototypes, but in the end, we've got something that appears to work.
The beautiful thing about this is that nurses are used to dealing with battery-operated systems with their IV systems. And so as long as they treat it like an IV and always have it plugged in before they go to use it, it should be business as usual for most of the nursing staff.
What's your name?
Tracy.
Tracy, I'm Zane. This is Dwayne.
Hey, nice to meet you. Hey.
I'm the facility director. Dwayne's the IT director at Hendrick.
But it does have a little bit of pressure because we don't want excessive pressure on these motors because it's going to be really hard on them.
Well, yeah, you'll take them out.
Well, and
but
it would also have a tendency to pop immediately.
You can just
So have you tried it with, I'm going to say a load on it, but when I say a load, like a patient tray that would have food on it, 15 pounds, so that's more than enough weight, don't you think?
Yes.
yeah, unless you got
Because they're using styrofoam trays.
If you notice the PPE or the gowns and masks, we want to use those where we can save them, so we can basically take the robot bed table into the room, be able to do FaceTime with the patients, family members, doctors, and staff. We started at 8 o'clock on Saturday morning, and then Tuesday morning we'll be able to use those in the room.
Not only are these great innovators helping the hospital, I hope they do something extraordinary like patent this information because I'd like to get this out to every hospital or quarantined unit because I can see this revolutionizing the way we deliver health care.